Even in this age of better testing and technology, we each have to be diligent about our own health, taking charge to seek the screenings we need. Linda Jacobs did that. She pursued a mammogram when she, now that's Dr. Walsh. That's Dr. Walsh, and that's Linda Jacobs. Linda Jacobs is a breast cancer survivor, and Dr. Christine Walsh is here today from Genesis Imaging. It's so great to have you both here today. I want to show the cover of Healthy Cells magazine and your team here, Dr. Walsh.
That's right.
Tell me about how much more you're able to do now when it comes to breast imaging.
Yeah, so really what I want to talk about is our new three-dimensional mammography that we've been offering now. It's been in the Quad Cities getting close to a year. It's kind of the latest and greatest new technology that we have in breast cancer screening. You can consider it like a CT scan of the breast. So you get multiple thin slices or pictures of the breast tissue as compared to one single picture that you get in a traditional two-dimensional mammogram. And it's shown to be about 41% more accurate than the old mammograms.
When you see these pictures side by side, you can really tell the difference between traditional and 3D. Now, is that the kind of mammogram that you had as well, Linda?
Yes,
when you went in?
I had the 3D imaging.
Now, you had an interesting case personally, in that you had pain in one of your breasts.
Right.
You went to your doctor, and what happened when you complained of that pain?
I told him that I had pain in my right breast, and it had been going on for 3 months, and I just thought I had pulled a muscle, and I asked for a mammogram, and he said, well, I wasn't due for about 3 months, just to wait. And I said, no, I think there's something wrong. I really want a mammogram. So I did get the order, and I had the mammogram done, and sure enough, I found out shortly thereafter that I had stage 1 breast cancer.
Well, now, Dr. Walsh, you were part of the team that helped treat Linda. How often does that happen, where breast pain ends up being a malignancy?
So breast pain is definitely a more rare presentation of breast cancer. Typically, breast cancer presents with a painless lump, or it's even something that's not felt by the patient. However, anytime you have a new symptom, even if it is breast pain, it's really important to bring it to your doctor's attention and to get it looked out, get it checked out, because there's always a chance that it could be something a little bit more scary.
So do you recommend the 3D mammogram for everybody?
I would recommend it for everybody. I think it's becoming more of the standard of care, and we know that it finds more cancers, and it finds them at an earlier stage. And finding them small is definitely more beneficial to the patient.
So, Linda, what have you taken away from all of this now that you're a survivor now, and you're past your how long has it been for you?
6 months. I'm 6 months out. Yeah, I just think that everybody needs to be in charge of their own health care and be persistent and be your own advocate.
I'm sure that you recommend that as well, don't you, Dr. Walsh?
Definitely.
You know, that all of us be maybe more vocal and take a proactive approach.
Yep. If you have a symptom that's different for you, or you feel something, or have anything that's worrisome to you, you should definitely get it checked out. You can bring it to your doctor's attention, and you can even just call us directly and schedule a mammogram, and we would be more than happy to see you.
There's also there are other kinds of breast imaging. There's MRI, ultrasound. Did you need any of that, Linda?
I had it all.
You had it all, right?
I had the ultrasound, I had the biopsy, I had the MRI.
You went through the whole gamut.
I went through the whole thing.
And it really, I think, doesn't amaze us that this is available now, but the point is to use it, right? And that you may, this is a number you can call directly to the Radiology Group PC to get a mammogram on your own. I mean, you don't have to have a doctor's referral anymore.
Exactly, yep. If you are due for a mammogram, or if you have a symptom, just feel free to give us a call and schedule an appointment.
Well, Dr. Walsh, thank you for the work that you do and your team as well at Genesis Imaging Centers. And Linda, congrats.
Thank you.
You know, we're in the sisterhood of survivors now, right?
Yes.
A club nobody wants to be in, but you know, but there is a great camaraderie and I think a fellowship in that. So that's a cool thing. So it's great seeing you both today.
Thank you for having us.
Thank you so much.
Appreciate
Continued good health to you, Linda.
Thank you.
So buying